The broadcast is now starting. All attendees are in listen-only mode.
Good morning. This is Deanna Mitchell with Leading Age Michigan, and we want to again welcome you to our Friday, June 26th, Safe and Calm webinar. Today is the day we've been waiting for a while, as Executive Order 108 expires at midnight. But we will talk about that a bit more later in the presentation. Our agenda today does follow our usual format. Dalton Herbal will provide an advocacy update, and we will have a brief situation update as well, since the numbers continue to change both in Michigan and the U.S. Our general updates will focus on visitation and other long-term care facility requirements that are currently in place. We know that they're likely to change at 11:59 tonight, and we'll talk a little bit about that as well. So we will now turn this over to Dalton for his advocacy update.
Good morning, everyone. We'll be touching on a couple of things here. We'll be talking about some of the legislation that's been moving, more specifically Senate Bill 690 and 956. Not so much in detail, but providing updates. We'll be talking about Leading Age Nationals ACT campaign. They're looking for members to get involved with that campaign to support long-term care on the federal level. We'll also be talking about some some of the Leading Age Nationals goals for the upcoming COVID relief bills on the federal level, the emergency housing assistance bill that is also available on the federal level, and then we'll be recapping some of our call with Governor Whitmer yesterday. So updates on the process. If you've been on the calls, you'll know that yesterday was going to be the last session day for about a month for the legislature as they move into their in-district work periods. During an election year, these work periods are largely focused on campaigning and establishing a platform for the upcoming election. On the call yesterday, and this is kind of foreshadowing what we talked about there, the governor said that her policy platform includes Senate Bill 690, so we would expect that to be signed soon. It's still underneath that financial review, but we are assured that she'll be signing that soon. And also, Senate Bill 956 passed the Senate on Wednesday evening. On Wednesday's call, we said it came out of the Health Policy Committee. It has since passed the Senate, largely based on Mike Shirkey's influence and desire to get that moved before break. And so on the next slide, we'll be discussing some of the more specific things of 956. This is more so a recap slide for those who weren't on the call Wednesday. An interesting thing to note, on the floor, an amendment was added to add Laura to being responsible for this implementation process. So now MDHHS and Laura will be working together, which is a shift in the way that things have been done and actually brings us some hope as the departments actually start to work together more closely. We feel some of the problems have been because Laura and MDHHS have been siloed over the past couple of months. So what are some of the specifics? The department has to evaluate each regional hub and then report that to the House and the Senate. And the department, in this case, is Laura and MDHHS. They have to investigate, evaluate, and then report to the House and the Senate. They have to develop a plan to create COVID-only hubs, one in each health service area, and these would care for people who are ineligible for care at a hospital, nursing home, or adult foster care. And the bill also makes individuals who are COVID positive and not allowed to be retained or admitted, it makes COVID positive individuals ineligible for nursing home care or to be retained or admitted to a nursing home. Unless the SNF can designate and demonstrate their dedicated unit as following proper care and isolation procedures, and those procedures would be approved by the department. Moving on, The Leading Age National has launched a new campaign, I believe, this week. It's largely based on a letter that you see on the right here and that we talked about earlier that they wrote to Nancy Pelosi, Kevin McCarthy, Mitch McConnell, and Chuck Schumer. The campaign I've provided links for here. The top link allows you to send a personalized message or call. And then beneath that, these links include talking points and form letters for you to use to send to your federal representatives. The campaign really focuses on 5 essential actions, which I've highlighted on the next slide. These essential actions that Leading Age is looking to support on the federal level include immediate access to ample and appropriate PPE, on-demand and fully funded access to accurate and rapid results testing, assurance that states will consider the health and safety of older Americans as they reopen, funding and support for aging services providers across the continuum of care, and recognition for the heroic frontline workers who are risking their lives. Out of this, they've also developed what they're looking for out of the next COVID bill package in more particular and more specificity. They're looking for a $100 billion fund to cover the costs of PPE, supplies, staffing, and testing. They're looking for $1.2 billion for affordable senior housing to cover COVID-19 costs, service coordinators, and wireless internet. $10 billion for the testing of staff, and that includes costs such as hiring additional staff to cover those who test positive. They're looking to allow home health agencies to be compensated for telehealth visits and for verbal orders to be for eligibility and billing. Strengthen and provide additional funding to Medicaid and other existing programs such as the Paycheck Protection Act. And then lastly, they're looking to create a bipartisan congressional committee on the future of aging services. There's also currently a House resolution called the Emergency Housing Assistance for Older Adults Act of 2020. That's House Resolution 6873. This resolution provides $1.2 billion to help HUD Section 202 housing and Section 8 housing for rental assistance. $845 million to cover staffing, cleaning, and disinfecting, PPE services, security, and other things. $300 million for service coordinators, $50 million for wireless internet, and $7 million to extend HUD's integrated wellness program. Lastly, we had a call with the governor yesterday. You can see this little screen capture I took here. There was other stakeholders on the call as well, and some of our members were on. Thank you for attending for those who could. What did she talk about, and what do we expect her to address today a little bit? She, on the call, repeatedly said that we need to keep our guard up when it comes to COVID. To me, this meant she doesn't plan to remove restrictions in the near future. She was really kind of disturbed by some of the numbers that she's been seeing and some of the actions she saw on the news, highlighting people at a bar where 25, 30 cases of COVID got spread. She's really proud of what Michigan has done so far, but still very cautious. As I said before, she's planning to sign Senate Bill 690. And then on the national level, she's looking for support for the HEROES Act, which is the 4th COVID aid package. She is still planning to use federal dollars to backfill budget holes in the state. She's working with governors from across the country and across the aisle to get this done. Her quote that I liked was that that this is a 50-state issue, not a single state issue. And so everyone is moving towards the same goal, at least with the governors. A couple of other things before we move on that just came up late last night, early this morning. We heard from the department, as you know, in Senate Bill 690, which is the direct care worker funds. There's also $1.5 million for Laura to do infection control surveys. Laura let us know that their goal is not for these to be CMS surveys. They're really designed to be consultative and educational. and foster a collaborative environment. And so they thought it was important that we share that to our members. And I would agree, because you just see 1.5 million for infection control surveys and you're like, oh boy, here we go again. So I totally get that. And then lastly, on today's call, the governor is going to announce the formation of a nursing home task force. We are proud to have Dave Herbal be appointed to that task force, and he's going to be serving on that task force to represent all our members. We're very excited and very proud and very hopeful that something positive will come out of this.
All right, so I do have a couple questions for you, but before we can get to those questions, Leading Age Michigan would like to extend our sincere appreciation to our generous business partners who continue to continue their support of our annual conference despite it being temporarily postponed. We look forward to your continued collaboration and we remain grateful for you. All right, do you feel the Senate bill for regional hubs would be signed into law by the governor?
No. In fact, the bill has a long history. It started in the Senate Oversight Committee. That committee was doing an overview of the state's COVID regional hubs and the COVID plan. And that committee was largely criticizing the governor's actions that she's taken regarding COVID. And so this bill comes out of that, and through the process has been very partisan and very political. Essentially, if she was to sign that bill, she would be admitting to the Republicans that she made a mistake. And so I don't think I can see it being signed, but I do know the Republicans plan to move that bill through the process to get it on her desk to force her to veto it.
All right, someone said, sorry, I just came in late. Did the governor sign 690?
She has not signed 690 yet. It's still under financial review. On a call that we had yesterday, she indicated that she was going to sign it and that she is proud of the bill. So I would assume that once it goes through the formal process, she will sign it immediately or as soon as she can.
Okay. Someone says that bar is now up to over 50 cases. So do we think this means she's going to extend Executive Order 2021-08 restricting visitors, or can we anticipate MDHHS putting out some guidance today allowing it?
Deanna's going to talk about that a little later. Oh, go ahead, Deanna.
Yes, we're going to talk about that a little bit later. We're really unsure. We know that the department has been just internally weighing all of the issues and going back and forth, but we will talk about that. However, we do have to say at this time, we should know this afternoon, but we're not sure yet.
All right. What is the payment process with the $2 payment to staff? When, how will the facilities get the money?
There has been no conversation about that so far. The department said that they're waiting. The department is being put in charge of those funds. We have talked to the department and voiced some concerns about the way this could be implemented. We know providers throughout the state, because of the current landscape, are facing financial pressures that they never had before. Many operating on a shorter time frame than they ever have. And we think that if this was going to go through some sort of reimbursement process, it could be a delay. Unfortunately, the bill doesn't give us any kind of strict setup or framework to see how they're going to operationalize these funds, and it's up to the department. So we'll continue to have those conversations, and we hope to have an update shortly once the bill is signed.
All right. I don't have any other questions. Just someone said that nice screenshot. So.
Thank you. I worked on it a little bit.
Yes. All right. So other than that, I think we are good on the questions here. It looks like we can move forward.
Thank you, Blake, and thank you, Dalton. So we're going to do a very brief situation update this morning. I try not to do that on Fridays, but because the numbers are still moving upward, I thought we would take a quick look at them. So on to the next slide, Blake. While the U.S. is still seems like it's having a bit of a surge. The death rate does continue to fall in comparison to other areas. At our high, I think that we had something like 33% of the proportion of deaths, and we're now down to 12, as you can see on this slide. So that at least continues to look promising. What I'm hoping isn't happening is that obviously the death rate is going to follow at a distance of the case rate. So I'm hoping that we don't see a surge in the death rate in the next couple of weeks as their hotspots are growing in part of the country. So this is our the slide that we put up all the time, the 7-day rolling average of daily new cases, and this is of course just Michigan over the past 60 days as of yesterday. And you'll see that our numbers are continuing to go upward. In our conversation with Governor Whitmer yesterday, she said she was not really alarmed yet about the overall spike across the state and thought that, you know, these ups and downs would be expected. So it's still not clear if it's just one of those routine spikes or whether or not this is an extension of the first wave. But the governor did note that she watches these numbers very closely every single day. The death rate continues to decline, and that's really good. We will continue to monitor to see if it continues to go down or if it starts to rise again as a reaction over time to the increased numbers of cases that are in some of the Michigan urban areas. Really is what's beginning to spike again. So we would expect to see some delay in changes in the death rate compared to the case rate. Or the increased numbers could mostly be due to more cases in younger age groups. We are hearing about more group activities in younger age groups with the reopening, and it could be that they're a little bit more healthy and it won't impact the death rate. So we're watching that to see if local transmission rates really change, and eventually if indeed that could affect our residential communities. So this is the Michigan reported nursing home data as of June 24. We have tried to monitor this data over time, but to be honest with you, I stopped looking at it very closely because it was hard to develop any real insights or trends since the data was just seemed so inaccurate. But now that the department seems to have their arms around this a little bit better, we'll start tracking this weekly and watching the trends as things move forward. I do know that the first caseload numbers reported hovered around 4,900 by the time they started actually counting. And the current caseload is at 7,290. But remember that those first numbers may not have been accurate. So we may not have had that big of a incline over the last several weeks since they started reporting. It's hard to say, but from this point forward, we're going to look closely. The death rate in our nursing homes is about 28% based on these numbers, and yet we're still waiting to get a glimpse at the HFA AFC numbers, which we don't have access to yet, of course. So we're going to move forward now and talk about what's on everybody's mind, reopening and visitation. Over the past week, we've gotten a lot of questions about what the current regulations are for certain aspects of visitation. It almost seems like with all of the talk of reopening and all of the executive orders that opens pieces out in the community, such as hair salons and restaurants, etc., would apply to residential settings. And in general, they do not. There's also the issue about defining independent living and whether or not they should or should not be covered under all of these executive orders, and they are only covered under the one, of course. So it seems like people have forgotten the basic rules, and since these are the critical topics for today, we thought we would go through the general guidance about where we are, and then we're going to talk a little bit about where we think the department could go, depending on their final outcomes this afternoon. And of course, CMS just issued new guidance in the form of FAQs on visitation as well. So we'll talk about that for a minute. So a brief review of the the frequently asked questions that were issued with QSO 2028 is really the basis for visitation rules. It relies on these documents that are listed on the slide. Note that the blanket waivers document was updated for nursing homes yesterday, and we'll talk a little bit about that later. They have taken away one of the waiver provisions for nursing homes. So QSO 2014 revised was the first directive that restricted visitors and non-essential staff, with the exception for end-of-life care. And I've put a summary of the requirements here. Since that time, CMS has put out some context, though, and I think it's important context for thinking about end-of-life care, as well as communal dining. So this was the base for further directives for nursing homes. And members should note that these are also recommendations for assisted living. Even though CMS doesn't govern assisted living, these were recommended for them as well through CDC and other guidance. One of the big media issues of the day, and we have been interviewed by the media twice in about the last month about this, is whether or not Michigan nursing homes were mandated to take COVID positive residents. CMS has gotten a little defensive about this, and they have relied on the fact that they focus on the facility ability to maintain transmission-based precautions as a requirement. However, that's always been true, that as Medicare providers, we're required to accept patients unless we could not, for some reason or other, safely or appropriately serve them. And of course, there was the directive here that facilities should continue to admit anyone it normally would, with a caveat that in order to take a COVID resident, you should have a dedicated unit. But in reality, we do know that there was strong pressure for nursing homes to take these patients, and there wasn't really another place to go. So even though they technically didn't mandate a facility to take it, there was strong pressure for everyone to take these patients. And then there was an April 2 guidance from CMS that focused on what the state activity should be, with a note that states should ensure PPE needs. Obviously, there was a big concern about that in the beginning. At that time, we were still competing with hospitals and alternate care sites for supplies, and I think that's a major lessons learned as we go forward. And in this guidance here, they also introduced the idea of dedicated units, dedicated teams, and optimizing PPE. And then, of course, there are the blanket waivers. Our latest word on these is that as the pandemic progresses and things hopefully calm down a bit, CMS will resync these waivers on a case-by-case basis. In other words, it's not their intention to take these waivers and just discontinue them as soon as they decide that the environment is safe to do that. They're going to think about them. Some of them may well survive into the future. However, note that yesterday they ended the waiver for reporting staffing data. Memo 2034 NH has been issued, and that updates this along with some changes to quality reporting. These are the rest of the waivers that impact nursing homes. I just like to put out a complete list in case someone wants to use this as a reference. And again, the only blanket waiver for nursing homes that's being rescinded is the staff reporting piece that is discussed in the next slide. So, QSO 2034, effective on July 29th, staffing measures and star ratings are going to be held constant based on where they were in the fourth quarter of 2019. Nursing homes must start reporting calendar quarter 2 data for staffing by August 14. but CMS encourages everyone to report Q1 data as well. And they did note in their guidance that 60% of facilities went ahead and reported their data anyway. All-star ratings will be held constant until fall, although some of them could change a bit based on any newly collected data for the performance period before December 31st. So there's some chance that some of the measures could change, but they're not going to change based on any data after January 1. So on May 18th, CMS issued its reopening guidance that focused on 7 areas of concern when looking at visitation and reopening. And these 7 are generally used by the state as well as they're looking at visitation issues across the board, in fact, and not only for nursing homes. But obviously, case status in the community and case status in nursing home. Everything else is pretty much considered to be a constant. You have to have those last 5 bullets regardless. But the case status in the community and the nursing home are the driving pieces that are expected to really govern whether or not and how much facilities may be able to open, whether or not you're assisted living, HFA, AFC, or nursing home. So CMS recommended to the states that they considered phased reopening and left it up to them to consider how to do that. They offered ideas about statewide, regional, and individual facility reopening so that they could do it in different ways. Phase 1, and these are the CMS phases, not necessarily anybody else's, which most of the state would be considered to be in now, is still characterized by significant mitigation in the surrounding communities. In other words, there's still quite a bit of transmission going on, although it seems like we're hovering close to getting out of that situation. Moving to phase 2 requires that there's no rebound activity in local community transmission and no new cases in nursing facilities. And those are the 2 strongest drivers about how and how much we're going to be able to open. All the phases require standard staffing, PPE, local hospital capacity, etc. So here are the CMS recommended requirements for phase 1. Unfortunately, again, these phases do not align with the state phases as issued by the governor. And just like the criteria to move from one phase to another assumes adequate staffing and supplies, but relies on the transmission rates, the activities that change under each phase really also have this underpinning of requirements that don't change, but loosening visitation and some activities change. So in terms of getting to a phase, it's all about community transmission and facility transmission. And then once you start moving along those phases, it's only tweaks in visitation. You still have things like weekly testing in these requirements, ongoing screening, the need to keep up dedicated units, et cetera. Those things don't go away in any of the phases. So perhaps it'll be like this until we're assured that the entire pandemic is behind us. So this is CMS phase 2, and you'll note that I've highlighted in green here the things that change. Visitation is still prohibited. Limited non-essential personnel can move in and out. Communal dining is okay with social distancing, really not a change from phase 1. They do open up some group activities to no more than 10 persons with social distancing. Phase 3, just some tweaks. Visitation is now okay with close screening. Social distancing still is appropriate. Non-essential personnel, same thing. Communal dining limited. Group activities, including outings, are now okay with asymptomatic and negative residents only, and limited numbers. And of course, you have to continue social distancing. So those are really the only tweaks throughout all of these phases, according to the CMS guidance. So we're going to take a minute and pause for any questions about the CMS guidance before we move onto the newer visitation Q&A, which I thought was extremely timely and helpful as Michigan starts to look at opening up. And we've made sure that the state is aware of that guidance. And also then we will look at the executive orders. So we'll pause here for a moment for any questions.
All right, and then before we get to those questions, each year Leading Age Michigan is thrilled to spotlight the new and innovative programs and services displayed by our business partners at our Solutions Expo. During this historic and challenging time, we would like to celebrate our business partners who have maintained their commitment to our members during our short delay. Please thank our business partners by supporting their programs when you are in need of their services. So I do just have one question right now, and it is, Deanna, what is your source on the 7-day rolling average charts? They are always nice, and I would like to be able to look them up myself.
Well, I make them myself. So the 7-day rolling average from the Financial Times, which is the world view, or the 7-day rolling average from the Michigan data, I make them myself. So I can send them, or we actually do post them, not absolutely every day, but every day or two on our website as well. Shoot me an email and we can work through it.
All right. At this time, is HFA reporting any COVID data? And if so, who to contact if access to portal has not been approved?
I think that, yes, HFAs and AFCs are supposed to be reporting right now using pretty much the same parameters as the skilled nursing facilities. Please shoot me an email. I actually, off the top of my head, am not sure who to contact at the state, since I don't know that that's under MDHHS or if that's under Laura. But we will look for that, and I'm sure Laura Funch can help with that as well. Please shoot me an email.
All right, and then if you don't have Deanna's email, it is just her name, Deanna, DEANNA, at leadingagemi.org. Other than that, I don't have any other questions at this point, so it looks like we can keep moving on.
Okay, great. Okay, so I think one of the most important documents that we've gotten in the last couple months is the FAQs from the CMS, and it includes visitation criteria. And in context, in other words, it doesn't seem like the hard and fast rules changed, but their interpretations have definitely softened. And I believe that this is probably in response to information being fed to them about the dire straits that some of our seniors are in because they are so very isolated. Some of these rules seemed really rigid when they were first announced in March. We have made sure that Kate Massey at MDHHS got a copy of these. When we were hearing rumors earlier in the week that the state may not open hardly any activities for senior residential care at this time, I feel personally a little bit more optimistic this morning. We do have a call with the department this afternoon to get kind of a heads up about that. But it's our view that there are ways to safely open up visitation in order to better meet our seniors' needs. So this guidance pretty much aligns with earlier QSO letters. It uses the same basic criteria for moving through phases, with an understanding that you cannot reopen to visitation if a facility has staffing issues or PPE issues, and that's still a basis. However, the other requirements and considerations feel much more positive and amenable for seniors. So additionally, you have to have testing capacity, hospital capacity. Those things are restated in this guidance and are not new. One of the big parts about the guidance, though, is the discussion about compassionate care, and they spend quite a bit of time on that. And this has been a concern for us since we had guidance from the state for HFAs, AFCs, assisted living, and independent living in terms of visitation and compassionate care. But the clarifications that were coming through for nursing homes were different. So it almost felt like some of the rules were softer for nursing homes than for these other settings. So we would like to see some alignment. We've said that to the state a couple times. These clarifications have been provided to the states, though unfortunately don't necessarily alter how the state will view visitation for these non-nursing home entities. CMS notes that there could be some restricted and careful visitation for persons right now, especially for persons who are somehow really negatively impacted by lack of visitation. So when you think about compassionate care, you do not have to think anymore just about end of life. They think that this should be looked at on a case-by-case basis, based on individual need and in consultation with the family, the resident, the clinicians, and strong safety precautions still need to be in place. And that the visit should not be routine, that they need to be necessary and limited in number. But you need to look at the whole picture for a resident, consider their well-being, and then move forward from there. However, at the bottom of all of that, they require that you consult with state leadership. So if the state doesn't say that we can do all these things, we can't. But these are the things that we think are absolutely necessary for our seniors moving forward. So one of the other things I thought was really optimistic was that they identified ideas for creative visitation, those activities that would be considered safe to support some limited visitation as the pandemic wears on, safe ways to see the family outside of the facility, using scheduled appointments, being very careful, limiting the numbers of visitors at any given time and perhaps only at specified times. Observed visitation was a big thing, understanding that if you're going to do this, you really have to observe at a distance, of course, to make sure that people are really obeying the safe distancing rules. Obviously, you need a safe place. Visitors should not be traveling through the facility. Outdoor spaces are good for that in this weather. And of course, all of it with social distancing. This is the part of the guidance that we're hoping that the state pays attention to, both for nursing homes and for the other provider types as well. CMS guidance stated clearly that they did not mean to completely restrict communal activities. I actually don't believe that in the beginning. I really think they did. But if we can maintain social distancing for activities involving non-COVID or non-COVID suspected residents, that would be fine. And we all know a lot of facilities have already been doing what some call 6-foot bingo. But that's definitely where we're hoping the state's going to go. The guidance included the same factors for reopening. They reiterated and underlined, if you would, these pieces. And again, it's about case status in the surrounding community, and case status in the nursing home is going to drive most of the decision making, assuming that the other things are pretty stable. But as the transmission areas that impact the facility at most, in our minds would be a county rather than some of these regions that we have in Michigan that may have 12 or 15 counties in them. And we have talked to the state a lot about that as well. This recent guidance reiterates and is in alignment with a lot of the previous directives about the need to provide electronic visitation, and that pretty much anyone who is COVID positive or suspected positive should not receive any visits because the risk is just too great there. These FAQs also focused on access to the long-term care ombudsman and the right of the resident to continue to contact and communicate either in person, if it's allowed, or electronically. Nursing homes will still need to allow them access to records And all these requirements are in QSO 2030. So they want to make sure that even though, everyone continues to be pretty isolated, that they have access to that ombudsman if needed. Okay, now for the trickier areas. Executive Order 108, which is in effect through today. It goes away at 11:59 p.m. tonight. The controversial aspect of this order was the inclusion of assisted living and independence living, for which we continue to have absolutely no definition. And providers across the state have taken a variety of opinions about whether or not they should be included if they're an independent living community, whether or not they should be included or they're not included as covered under this guidance. So all these entities, though, must prohibit visitation with the known exceptions. Parents and guardians who need to confer with residents for some reason, persons at end of life or compassionate care, persons who need who provide medical care or ADL care, of course. Staff are essential and should be entering the facility at any time. Uh, 108 also calls for screening of staff and all persons entering the facility for symptoms, contact with COVID positive persons. We do understand that for independent living, that's quite a challenge as people are coming and going since the stay-at-home order was lifted. And of course, all staff and visitors must wear face coverings. The other major executive order that we've had to live under lately is 123. It has also had a major impact on senior providers, and this EO is in effect until July 12th. This is the order that includes the requirement that all residential providers create a dedicated unit if possible. That was a relatively new addition as these orders were extended. And that COVID positive persons can only be served in a dedicated unit or a regional hub. But still, regional hubs can only receive COVID patients from hospitals or other nursing homes. Although we have seen the state kind of respond to our concern about the fact that some assisted living level facilities, HFAs, AFCs, may have a COVID resident that they don't feel comfortable taking care of, or don't have, a dedicated unit that they can properly separate the person from others. And so they have initiated some conversations about allowing some of these patients to go to regional hubs from those settings as well. We'll have to see how this plays out with the recent legislation. We don't anticipate that they're going to sign, that the governor's going to sign it, even if it is passed. But we do know that MDHHS is already thinking about these regional hubs in relation to the next expected wave. So we know that we're going to have more conversations about these hubs moving forward. So where are we going next? We believe that there are flexibilities that are possible in alignment with the CMS guidance that speaks to things like the creative visiting piece. And these could safely provide the opportunities to meet our seniors' social needs. We believe that we cannot live in crisis, in isolation forever. We've also repeatedly discussed the need with the state for not only more clarity about the definitions for assisted living and independent living, if they're going to throw those about, but to better understand the intent, like what are the characteristics of those settings that would include them or make it be important to include them in visitation and other restrictions. In other words, what are we trying to do here? What is the rationale for including or not including them in such executive orders? Lastly, we currently have a call scheduled this afternoon with the department. We do anticipate that they're going to give us a heads up about what's coming later in the day. However, note that many of these calls get canceled, and they canceled one just yesterday to do the same thing. So we're never sure what's going to happen until it does. And in fact, the canceling yesterday led us to believe that maybe they weren't ready. And we do know that there's been some back and forth in the department about what the best options are here. So we've heard that there are differing opinions between the clinical staff and the public health staff, along with the other staff at MDHHS. So at this point, we're still unclear. We have provided much documentation and opinion and recommendations to loosen these restrictions in a safe way. So we'll have to see how they decide to move forward. So those are just some of the issues. We would like to hear from you. We can take some questions or ideas now. You can also email any ideas or issues that you have to us later, as usual. But that's kind of the state of the world in terms of long-term care in Michigan today.
All right. So we would just like to say thank you again to all of our exhibitors that stuck with us through this challenging time. Just please support their programs and their services when you are in need. As Deanna did mention, I will pull up the slide with everyone's emails. That way you have those, and then I will get to the questions. All right. So right now the public can wear homemade masks. Can we expect this will be okay for our families that visit, or will we need to provide them a surgical mask?
Right now, your non-direct care staff can wear cloth masks. I would anticipate the visitors will be able to as well.
Okay. Do you believe the governor will have another executive order to extend the restrictions?
Well, you know, with the idea that I don't know that we're good at it, but it's really hard to anticipate the state. Things go back and forth. It almost seems like they change their mind every hour about things. So they haven't landed on anything, I think, as of early in the week. They were still discussing it all heavily by midweek, that we know that. I anticipate this morning, it feels like to me, that they're going to maybe tweak some of the visitation requirements, but they're certainly not going to just open nursing homes. So I think that they're going to extend the visitation restrictions, but we hope that they do some creative things with allowing some sort of visitation in certain areas with certain safeguards.
All right. What is the implication of EO 2020-108 being tied into the emergency order that MDHHS put out about testing and reporting? Will it stand?
I'm sure that the testing and reporting pieces in that will stand. I know that they're at no point going to give up on the needs for understanding what the transmission rates are like in nursing homes. And in fact, they got a lot of flack about the fact that it took them so long to get some accurate and decent data. So I'm sure that they're not going to stop that now.
All right. Has there been any update on extending the testing mandate past July 3rd?
No, but I would anticipate that they're going to do that. We would hope that to us, that seems kind of like really just a messy thing. The resources being difficult, the requirements to do weekly testing for staff are difficult. However, the CMS has the same guidance. And I do know that the epidemiologists are hard on that issue as well, in order to understand what the current state is, to understand what's happening in nursing homes. They have to have testing. Now, what we would like is a little bit better support for testing, maybe a little bit less frequency, and definitely we think that deciding whether or not you have to do weekly testing for staff based on a 15-county area is inappropriate. And we've told the state that. We would like to go to a county-based system. They actually did say that they would consider maybe that in the future. We hope they do that. but we do know that the testing pieces are going to continue in some form.
Has the state come up with how to pay for all the testing requirements?
They have developed a draft reimbursement plan. They took our recommendations about that a couple days ago. We have not gotten an update since we saw their draft plan. It seemed somewhat complicated to us, unnecessarily so perhaps. So they've gotten a lot of feedback from providers about that, and we hope to have them put out something that's meaningful and helpful soon. However, again, it always takes longer than we think it's going to, and they say it's going to. So I would anticipate, though, maybe early next week, if not today. However, they did have guidance that was scheduled to go out Wednesday, but I think they got so much feedback about it that they had to take it all back and rethink it.
All right, it looks like that was the last question that came in. So I would like to say thank you to both Deanna and Dalton for all the updates. We would also like to thank our members and participants. I believe we had around 65 people that took time out of their busy schedules to join us. We appreciate everything you guys do each and every day to support your staff and provide quality care to your residents. We are grateful for your continued support, and we are here for you when you need our assistance and resources. I believe that will conclude for today. So everyone have a great rest of your Friday and have a great weekend. Dalton or Deanna, did you have anything else you'd like to say?
No, thank you, everyone. We will be sending out an update when we hear from the governor and the MDHHS. So good luck, everybody.
Thank you.